Welcome back. This is Dr Hitendra Bhagwatkar, interventional cardiologist. I just like to say something about the machine, that is Pinnacle Agile machine, which we are using from last 2.5 years. In this machine, we have done almost around 5,000 procedures, and it's working well. We get very much better advantages with the clarity of the machine, and which help us into better pre and post procedure assessment of the patients. As you can see, this is the running angiography of a patient where we can see the patient having blockages in the ariocaudal view in the OM, and also you can see the stent also. So he's having some blockages inside the stent. Here in this view, the stent is very clearly visible, which is a very old stent. 20 years back, still it shows a very well delineation of stent with the blockages can be seen in this. And also on the right side also there is a stent, and before the stent there is a 70-80% blockages are there. So because of the zoom view and the enlarged view, we have a better magnifications where we can see a better and pictures, and we can take a better decision for this patient. So here also we have a huge screen where we can visualize the images, 5 images at a time we can visualize. One is the bigger images and the 4 images we can visualize all at a time, and then we can differentiate between the blockages pre and post, how is the result advantage, and that help us to take a better decision in the management of the patient. Next things we like to show and we use in some of the complex cases where we need some assessment, extra assessment of the stent, is the stent clarity, where we see exactly how much the stent is expansion is there. Now this is a intervention radiology case where there is a subclavian stenting is there, and you can see the stent is very well expanded, and we can see the struts of the stent and the expansion of the stent. Another case I want to show is a coronary artery stenting, and the patient was having a severe calcific lesion, and you can see the some of the parts, you can see the severely calcium is there, and the stent is showing under expansion of the stent is also there. There is an overlapping of the two stents which can be also seen, and now the procedure is we are doing a balloon expansion where we try to expand the stent completely. So from the stent clarity we get a very better view of the stent and advantage for doing a better outcome of the post procedure. Radiation safety nowadays is the most important thing of the operators who are working inside the cath lab, because nowadays with the increased number of procedures, the most important thing is to have a less radiations and to prevent us from radiation injury. We can take a lot of precautions in this machine by using a less frame length which is there. Because of AI technology, we get a less frame length, and it adjusts itself according to the images. And because of the low radiation frequency and because of less of scattered radiations, we get the advantage of having a better images without any compromise in the image quality. We get very less radiation exposure from this machines.